Hello, everybody. My name is Vidhu Gullapalli, and I'll be presenting on utilizing the tongue surface for the detection of diseases via machine learning. So, a little about me. I'm a rising junior at the Liberal Arts and Science Academy in Austin, Texas. I'm part of the French Orange Society, Red Cross, and varsity swim team at my school. I'm the research intern at the University of Texas at Austin. I'm the co-founder and co-president of the Bio Plus Tech and Cheering Club, a nonprofit dedicated to youth career development. I'm currently developing tongue scanner and doing my own independent research, which I'll further discuss in this presentation. And my future aim is to utilize technology to make healthcare more accessible throughout the globe. So let me go over the topics in my presentation. First, I'll be discussing the problem, then my solution, which is called the tongue scanner, after which I'll walk you through the overall algorithm of incorporating tongue scanner in the process of diagnosing diseases, then touch on the main concept tongue scanner is based off, then talk about how the solution mitigates the problem at hand, and finally conclude the presentation. Let me start by introducing the problem. About 50% of the world's total population lack access to essential health services, according to reports from the WHO and the World Bank. As a result, the UN predicts that about 86% of global annual deaths in 2048 will be caused by treatable or manageable diseases. This is because alarming amount of these diseases are not caught during the essential time or not diagnosed at all. To mitigate this solution, let me show you Tongue Scanner. This is an application that leverages machine learning to analyze images of the tongue surface, enabling detection of diseases such as type 2 diabetes and certain kinds of cancers. By identifying subtle changes in the tongue's appearance, this tool aims to provide accessible diagnosis of diseases present in the body. Essentially, as seen by the demonstration on the right, the user inputs an image of their tongue and gets a prediction. Right now, the prototype can identify 2 diseases, but I plan on adding many more. Next, let me explain how the application would work in the overall process of diagnosing diseases. So first, an input of an image of a tongue is given by the user. Then the application compares the presented surface of the tongue with patterns it learned through data it was trained on. The application then classifies the presented sample into a category it shares the most patterns with, which is essentially the output. Then confirmation with the health professional is needed. Finally, the user will be treated accordingly. So let me explain the 2 key concepts involved in the tongue scanner. Let's first dive into the human tongue's attributes. So apart from being a biometric, that is, a human tongue has a pattern on its surface and different shapes, which is unique to each and every single person in the world, similar to the pattern on our fingers. The human tongue also has the ability to showcase symptoms of specific diseases, like diabetes and different kinds of cancers, via color dissociation are exhibiting different patterns on its surface. For example, figure 2 is of an image of a healthy person's tongue, but as one is impacted by anemia, the tongue tends to become more smoother due to the loss of papillae, which is small bumps in the tongue whose function is to house taste buds as showcased in figure 3. Additionally, when a person contracts type 2 diabetes, the tongue is coated with a yellowish layer, as seen in figure 4. So the second concept used in tongue scanner was a convolutional neural network, or CNN for short. And is the subset of machine learning. It was used in training data in this application, and it is a deep learning algorithm designed to adaptively organize features from input datasets of images and mainly used for analyzing them. Let me walk you through the process. So first we have an input image, which the model receives as pixel grids because that's how machines interpret images. These pixels represent the color intensity value of these images, and then goes on to the convolutional layer. This layer looks at small parts of the images at a time using special tools called filters. Each filter slides over the image, checking for simple shapes to find patterns, and goes on to the pooling layer. After the convolutional layer finds these patterns, the pooling layer helps simplify things. It does this by looking at small areas of each feature map and only keeping the most important information, and then moves on to the fully connected layer. And once the image has been broken down and important features have been found, all the information is flattened into a long list. The fully connected layer looks at this list and connects each piece to every other piece. And finally, the output layer. This layer takes everything the network has learned and turns it into the final answer. For the tongue scanner, the output layer gives a score or probability for each possible category. This solution helps address the problem in the following ways. It's cost effective. The solution offers an affordable technology-based application. Early detection. Compared to the rates on how various diseases are caught, this application could potentially give a sign to people who are unaware of their health condition to go and seek medical attention with confirmation from a doctor. Improved accessibility. 5.64 billion people around the world were using the internet at the start of April 2025. That's equivalent to about 70% of the world's total population. Figure 6 showcases how many miles people had to travel in Africa to seek medical attention, but those times are often due to noticing serious problems the disease already impacted them with. This solution could help people potentially notice it at least a little earlier through their cell phones and seek medical confirmation and attention faster rather than acting only after the disease has progressed an extraneous amount. In conclusion, the lack of access to healthcare is a major issue at a global scale because it will lead to a huge amount of the world's annual deaths caused by treatable diseases. The tongue scanner provides a sense of certainty before health checkups, so people could have a tool to make sure, to an extent, that they contain a disease. And the tongue's abilities to showcase the symptoms of specific diseases, like diabetes and different kinds of cancer, via color dissociation, or exhibiting different patterns on its surface, along with the efficiency of a CNN, makes a tongue scanner such a great solution to use. This solution's accessibility, cost effectiveness, and early detection has the capability to improve lives and potentially reduce the world's annual deaths by a substantial amount. I would love to thank my family, my computer science and biology teachers, for introducing me to the collaboration of machine learning on the lines with global health. Additionally, I would like to thank the Global Health Leaders Conference team for providing this enriching opportunity to me. Finally, I would like to thank everybody who listened to my presentation. Here are my references. And again, thank you so much for listening.